Point number 5. There is a test which you can do to identify if you have pneumonia, and this is known as the 6-minute walk test. Now, you have to walk at a pace at which you are comfortable, and before you start the 6-minute walk, you need to monitor your oxygen saturation and write it down. Go for a slow 6-minute walk, come back, sit, and again monitor your oxygen saturation. If your oxygen saturation falls by 5, this is a clinical test which can identify that you may have a possibility of going into a severe disease. Point number 6, blood tests. Yes, blood tests are a very important tool with which we physicians identify if you're going to have a severe disease or not. So if you're home quarantined, there are a set of 7 tests which I advise my patients to do, with which I'm able to identify whether they have a possibility of going into a severe disease or not. And I am going to explain the rationale behind those tests so you know why it is important and what it signifies. Now, the first test is a very simple test known as a CBC, or a complete blood count, and in that test I see only 2 things. I see if the WBC are less than normal. So if they are below 4,000 or they are very close to 4,000, it means that you might have a very significant replication of the viruses, as your immune system is not going to attack them. In the CBC, there is another test known as the CRP, or the C-reactive protein. If the C-reactive protein is high, that also signifies that your body is undergoing quite significant inflammation and you have to be vigilant. After that comes the most important test, which is the D-dimer. Now, all of you know that the COVID-19 is causing clots, causing small clots, big clots, but it is disrupting our blood flow. The D-dimer is a test which can predict if you have a tendency to have clotting. So if your D-dimer is above normal, then that is a good time to call your doctor. After this comes the IL-6, or the interleukin-6. The interleukin-6 is a test which has been constantly used to predict the cytokine storm along with the D-dimer. So if the D-dimer is elevated and the interleukin-6 is elevated, I will be quite worried. So the interleukin-6 is another test which you can do to identify if you have a risk of progressing to the cytokine storm. Again, one point about the interleukin-6 test. Sometimes handling of your blood sample or delay in processing it could cause some kind of an alteration of the results, because sometimes I have seen patients who are not very sick have high IL-6 levels. So if they are unrealistically high, I would advise you to repeat it. Then the vitamin D3. We need to know what are the normal blood levels we need to maintain. For bony protection, it is around 30 nanograms per deciliter, whereas if you need protection from respiratory infectious viruses, it has to be around 60 nanograms. And I'm going to share something which happened to me, which will really make you understand that you need to monitor these levels. I made sure that I had a vitamin D3 level of above 100 nanograms per deciliter as I was treating and seeing patients in the ICU where there was a high viral load. What happened was, I did not pay attention to it during the gap of the second wave, and when the second wave started, I did my vitamin D3 and it was just 28, and I'm right now on supplements. So if you are somebody with a lot of melanin pigmentation on your skin, monitor it. Monitor your D3, because the sun is not entering and it is not converting our cholesterol into vitamin D3 as we expect. So check your vitamin D3 levels. It is extremely important. After vitamin D3 comes ferritin. Ferritin is a blood test which also shows me that you have some thrombotic issues which can happen, and also that there is inflammation and some amount of superinfection which is going on in your body. Of course, there are a lot of other tests, but I don't want you to burden yourself with those, because if these tests are abnormal, then you need a physician's help. Coming to 2 other tests which I do, which is the renal function tests and the liver function tests. I do that because remdesivir, the drug which is very commonly used successfully in COVID-19, cannot be used if you have a very heavy liver problem or a kidney problem. And if that is so, I would like you to reach the hospital earlier so that we can monitor you and make sure that you don't progress to the need of remdesivir at any point of time. Now that the lab tests are over, I'm going to come to the CT scan. So if you're having breathlessness, or if you feel that you need to see if your lungs are okay, then most physicians would ask you to do a HRCT. Now the HRCT is a high resolution CT scan, and just look at the reports. They are quite confusing, and after this you'll be very clear on what it means. Every CT scan has two scores. One is the CT severity score and the other one is the CORADS. It's in the name, don't get confused. CT severity score is the score which shows how much of your lung is involved. CORADS is only for diagnosis. The scoring is from 1 to 6 in CORADS, and if you're above 3 or 4, it means that the possibility of you having the COVID, that's it does not predict severity. So 4 and above, it just implies that you have a great possibility of having the COVID even if your RT-PCR negative. So the CORADS is for diagnosis, whereas the CT severity score, that shows how much of your lung is involved. And I'm going to tell you an easy way to identify what the percentage is. So the CT severity score is out of 25. So if you have 8 out of 25, think 30%. If you have 15 out of 25, think 60%. And if you have anything above, it's quite severe and you need to come to the hospital. So the CT severity score is an indicator along with your elevated blood reports and your falling saturation. So if you have an involvement of 30% or more and you have a derangement of your blood tests and you're also not holding saturation and you're struggling to breathe, guys, whatever the time is, I think you should call your doctor. And this will really help you from not struggling to recover from the COVID, now that the beds are also not easy to get. So let us prepare and plan.